On Friday, on a Truth Social post, President Trump warned us to watch what happens as the Iran war enters a second week. Let's show you what he said. We have unparalleled firepower, unlimited ammunition, and plenty of time. Watch what happens to these deranged scumbags today. I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA,
Black and Brown Women Disruptors in Healthcare and Beyond. And so today we're going to take a step back from the U.S. healthcare policies that we usually talk about. And again, we're going to look at what we are watching unfold as the wars in Iran are continuing and the medical side of this global scale and the impact. The health consequences of war, you guys, because when people think about war, we think about geopolitics and military strategy and diplomacy, right? But Dr. Brown and myself, we definitely see something different. We see things that are burning up, the burn units filling up because of all the fires. We see trauma systems collapsing because hospitals are being blown up. We see the toxic air, the contaminated water, the displaced families, overwhelmed hospitals, if they're not already destroyed hospitals. So right now, Dr. Brown, the escalating conflict involving Iran is creating a major public health crisis that's unfolding in real time. And realistically, the news is just not even touching what we're seeing. Let's roll this clip.
In the past days, we heard from the Ministry of Energy that some of the water facilities of the country have been damaged. But what happened last night is quite unprecedented, as you can see behind me, and as Tehran wakes up to day 9 since the initiation of the American and Israeli strikes. And now I can say it's day, but it seems to be night, as the city is surrounded by a black cloud. And as you can see behind me, it's quite clear. Even when I was coming to the bureau, I saw drops of rain falling into my window, and I just looked at them. They were absolutely black.
Wow. That's biblical, Dr. Brown. That is biblical.
One of the medical concerns right now is environmental exposure. After strikes on oil facilities and refineries, massive fires have been burning for days. So this smoke isn't just unpleasant, it's chemically dangerous. The World Health Organization is warning about something called black rain. That's when smoke particles from burning petroleum mix with water vapor and fall back to Earth. So that rain, that black rain, carries hydrocarbons, sulfur compounds, heavy metals, and particulate matter. So medically, right, these exposures, they lead to acute respiratory distress, asthma exacerbations, eye and skin irritation, headaches, neurologic symptoms, and over time, long-term lung cancer risk. Dr. Sloan, we've seen this before.
Yeah, you're right. We have. That was 1991, the Gulf War, when the oil wells burnt in Kuwait, and hospitals across that region reported massive increases in respiratory illnesses. And so the difference now, though, is the population is more dense, right? So there's millions of civilians that live in that area around Tehran and other urban areas where the smoke plumes are now starting to drift, right? And this is not just today. This is going to be long term as they continue to burn longer. This population is going to have this type of pollution spread throughout. And so, yeah, black rain, this is not just a health crisis anymore. It's an environmental health crisis that, again, Dr. Brown, we don't really talk about that cost in healthcare because we don't see that kind of war here in the United States.
You're right. Dr. Sloan, when oil depots burn, they release these fine particulate matter called PM 2.5. They're small enough to enter the bloodstream and lodge is deep in the lungs. So PM 2.5 is linked to heart attacks, strokes, lung disease, and increased mortality in vulnerable populations. That's children, older adults, and people with asthma or chronic lung disease. Those are folks that are especially vulnerable. Their bodies cannot filter or recover from these exposures the way that healthy adults can. And if the water systems or soil become contaminated, and they will, those health effects can last years, even decades after a conflict ends. We're talking about generational harm. But here's the worst part. What if You have nowhere to even treat these medical issues that are arising in the war. Remember, they've been targeting healthcare facilities. Let's roll the next clip.
Outside of southern Gaza's only functioning hospital, chaos after an Israeli strike. Minutes later, with first responders and journalists on the scene, a second blast. Seen live on the air, striking the same spot. And here, that moment inside the hospital. In all, 20 people were killed.
It's hard to watch. Again, I know last week we had our transparency moments of how we were feeling about that, but to see it live on TV is a lot.
We talked about it last week, but this whole part of being desensitized, we're seeing brutal violence on our screens, on our phones all the time. And we talked about this last week, right? When hospitals become targets, to us, the most alarming development is the damage to the healthcare infrastructure itself. That's a war crime, by the way. According to international monitors, multiple healthcare facilities in Iran have been damaged since the conflict intensified. And, for people watching this from the United States, it's important to understand something. Hospitals are supposed to be neutral ground during war. And under international humanitarian law, medical facilities and healthcare workers are protected. That's not what we just watched in that video.
Not at all. Not at all. But because now they're not just being damaged, people are trying to be evacuated. And why they're being evacuated is hit again. So killing not just the people that are in the hospital, but the people that were there trying to help, even media. There were 4 media members that were killed during that time. So the consequences are enormous. And because hospitals, again, don't just treat trauma patients like what we see, orthopedic trauma and general surgery trauma. They're also treating pregnant women, dialysis patients, children with infections, people having heart attacks and strokes, sort of your everyday medical issues we have to address in hospitals. But when those shut down, even if it's temporary, those patients don't disappear. They don't get care. They just lose access to care. And so that's when you start seeing the mortality rate rise. Not just from the bombs, but because the medical systems collapse.
The mortality rate, that means more people are dying, okay? Just even in that video, you have the healthcare staff assisting, right after that bombing, and they're dead. That's decades and decades and decades of training that's lost in a moment, and that's hard to replace. So, just think about this. These war injuries, they're very, very different than what most doctors see, right, day to day. Blast injuries, for example, can cause damage in 4 different ways. Primary blast injuries, those damage the lungs and the ears due to pressure waves. And then there's secondary injuries that come from shrapnel and debris. And then you have your tertiary injuries that occur when a person is thrown against objects. And your quaternary injuries, that includes your burns and toxic exposures. And in many conflict zones, trauma surgeons suddenly have to manage mass casualty situations where dozens of patients arrive at once. Mind you, they're already in very, very limited spaces. So that strains your surgical teams, your blood supplies, ICU beds, ventilators. And then when those hospitals are already damaged or understaffed, that system can break quickly.
Quickly, like in a matter of seconds, right? So what are the other hidden healthcare costs of war that we haven't really talked about? Beyond the physical injuries, the pollution, the black rain, there's another massive thing that we're not talking about is the mental health side of this war. Civilians living through the bombardment of this experience. Watching what they see, dead bodies and the smell and the sounds and not being able to get away from it. That's a continuous chronic stress on their bodies. The sleep disruptions, like who could sleep if you don't know if the next couple of seconds your life may be taken? The anxiety, the stress, the trauma, the rates of PTSD or post-traumatic stress disorder and depression and even substance abuse go sky high in these populations if this is a prolonged conflict, so if this is going to continue. And the other people, the children that are exposed to this war are going to carry these psychological effects for years. And that's if they live through this.
When wars dominate headlines, discussion often centers on the politics and the military strategy. But doctors, physicians, we see something different. We see the human body come under extreme stress. We see environmental disasters that lead to chronic disease. We see hospitals struggling to function and we see civilians caught in the middle. The reality is that war is not just a geopolitical event. It is one of the largest public health emergencies a society can face. And the health consequences often last way longer, way longer after the bombs stop falling.
So Dr. Brown and I are just ready and willing and able to make sure you guys understand these healthcare consequences, the issues that we're going to continue facing if this war continues, and the global events, not just wars. We want to be able to help you see the full picture from a healthcare point of view, from a disruptive point of view. So that means you have to stay empowered, stay disruptive, and remember that your voice does matter, because we're AYA, contributors of MeidasTouch Network and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more updates. Have a great week.
Bye, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.